A jury is hearing evidence in a civil case against Seattle Children's.
The families of 77 patients sued over treatment they received in 2019 after possible exposure to mold in the hospital's operating rooms. Chris Ingalls is here now to explain how the trial that started today is the first in a series involving patients who did not actually get infected from this deadly mold, Chris.
Yeah, that's right. This is the thing that's a little bit different. So after months of reporting by King 5 in 2019, Seattle Children's admitted that mold in some of its older operating rooms killed 7 children over a 20-year period. The mold was eventually traced to faulty air vents, sickened more than a dozen others. The trial that's starting this week is about patients that lawyers say suffered even though they were not infected. The renowned Seattle Children's Hospital was the one hope for this little girl from Montana, born with a heart defect more serious than her doctor had ever seen before.
Nobody expected her to survive.
Jared Kaplan says doctors performed 9 hours of open heart surgery that gave his tiny daughter a fighting chance. It also might have given her something else that Jared didn't learn until a pharmacist handed him a medication he didn't recognize, according to the family's lawyer.
That's not my daughter, that's someone else. No, your daughter was exposed to Aspergillus during surgery.
The Kaplan family says that's how they learned that baby Weston may have been exposed to Aspergillus during her 2018 surgery. The mold is generally harmless, but in a sterile environment like an operating room, it can infect an immune-compromised patient with lethal consequences.
We basically were told that if she doesn't take it, she could die.
The Kaplan family claims the additional blood draws and antifungal treatments to prevent an Aspergillus infection caused their fragile baby more pain.
Driving around, screaming at the top of her lungs. I mean, she was screaming so hard that she was blue. And she wasn't our child. She was gray, ashen, she was throwing up constantly.
Families of 4 young patients who may have been exposed to Aspergillus at Children's are having their day in court, with more than 70 other plaintiffs who likewise received antifungal treatments are waiting for their suits to go to trial.
Importantly, none of the plaintiffs ever developed an infection or got sick from Aspergillus.
Defense lawyers have admitted the hospital is negligent for exposing patients to Aspergillus, but say these 4 children never became infected and 2 suffered no side effects at all from the preventative treatments.
We have admitted negligence for the exposure to Aspergillus, but you still have to think whether there was injury, harm, damages caused by this.
The hospital says no, there was no lasting harm to these children. This trial with 4 plaintiffs will be the bellwether that may decide how the trials of those more than 70 other plaintiffs in similar circumstances will proceed. So Joyce and Greg, this is just the beginning of kind of a long process here.
What about those who claim that they were infected? There were lawsuits about that, weren't there?
Yeah, some of those cases were quietly settled, but the cases that are, they're not in the same class because those children, this is a class of children that were not infected. So there's about 20 cases where families say their children were infected with Aspergillus at the hospital. Those cases have yet to go to trial. Again, more on the court's timeline, which this is just going to take a while.